If you've been struggling in your relationship for a long time, you might be wondering if your mate has a psychiatric disorder. Perhaps you suspect narcissism or borderline personality disorder. Both of these diagnoses are listed in the DSM as access to cluster B disorders that involve difficulty regulating emotions and behavior. Now, antisocial and histrionic disorders are also in cluster B, but less often quoted by partners who suspect their mate has a mental disorder. Hello, I'm Dr. Debi, and I've been helping men, women, and couples grow together for more than 25 years. Now it's your turn to learn what I learned and taught as a couples counselor and university professor. You are the wise woman, and this is your personal development podcast packed with instant encouragement and practical tips. And men can learn about women too, because this is a safe place where women are valued and men are respected. We talk about biology, socialization, behavior, emotions, communication, and connection, because men and women are different. Always have been, always will be, and that's a very good thing. If you followed the Johnny Depp Amber Heard trial, you may have seen Dr. Shannon Curry's testimony. Her evaluation supported 2 cluster B diagnoses for Amber: borderline personality disorder and histrionic personality disorder. Yes, Johnny and Amber are both actors, but their negative cycle was readily apparent. According to the evidence presented, Amber would attack, blame, and criticize Johnny. He would avoid her as long as he could, then lash out or walk out. Neither of his strategies helped. He reported that he stayed in the relationship because he didn't know what else to do. In fact, he believed staying was the right thing to do. Yes, he had problems with alcohol and drugs, so they both had seriously challenging issues. As a clinical psychologist, I used to diagnose and work with all the cluster B disorders, so I know firsthand what that looks like. Yes, I worked with couples who, like Johnny and Amber, were coping with multiple individual issues. Consequently, working on the relationship had to remain on the back burner until they could achieve a degree of individual emotional stability. That usually meant individual therapy for one or both partners. So, what about your marriage? Are you living with daily drama and manipulation? Do you wonder if your mate has a mental illness? If so, you've probably described your mate to your friends, who've concurred with your assessment. You also may have done an online search to confirm your suspicions. However, it's much more complicated than a simple checklist of your experience of your mate in the heat of conflict. That's why only a qualified mental health professional can diagnose a psychiatric disorder. Contrary to what you may have heard or even believe, most men and women are reasonably healthy, even the ones who are having a hard time in a romantic relationship. In every marriage, each partner needs someone who is available and responsive to their emotional needs. However, so much gets lost in translation between a man and a woman. They have different biology, different life experiences, and they've learned to cope with challenges differently. All that leads to a different worldview, a different belief about how a healthy human being should think, feel, and behave. As a result, they misunderstand the cues. They get frustrated and feel alone. They just don't know how to communicate with the opposite sex. So their efforts to connect tend to trigger resistance instead of a response. And those resistances can get quite intense in the heat of conflict. And when we're desperate, we're all capable of being dramatic and manipulative. That does not necessarily mean we are all mentally or emotionally ill. If you're being attacked, blamed, or criticized, you're going to get defensive. That's normal. The more desperate one becomes, the more dramatic are their attempts to connect or to disconnect. So, what's the test here? When do you know your mate has a clinical disorder? Well, first you have to ask yourself these 3 questions. Do I understand, value, and embrace our gender differences? Yes, men and women respond to feelings very, very differently. And if you can only see things from your point of view, you're going to totally misinterpret the other person's perspective. They feel very deeply, but they've been taught not to express that. Instead, they tend to take action. And sometimes that action is walking away in the middle of a conflict. Now, I'm not saying that's the best way to go about it. It certainly isn't. But if you can understand why he's walking away, it's because he's been taught not to engage in a verbal, emotional discussion. So it's part of his upbringing. It's part of his nature to be sensitive, and it's part of his upbringing to walk away from those kinds of conflicts. So then the next question you have to ask yourself is, am I responding well to my mate's bid for attention? I just mentioned walking away, but likewise, if someone walks away, we don't necessarily let them walk away. Sometimes we want to go after them because we feel very uncomfortable with the silence because it feels like they're dismissing us. And instead, what we need to do is learn how to take a time out that doesn't trigger the other person's negative response. So it's a reciprocal thing. It goes back and forth. How are you responding to one another? Are you doing the best you can? And then finally, what efforts have you made to help break the cycle? The fact that you or your mate get emotional when you're misunderstood is insufficient for a clinical diagnosis. However, if you feel like you've done all you can to make the relationship work and that you've learned to respond without running away or becoming dramatic or manipulative yourself, you may want to seek the help of a qualified mental health professional for further evaluation. If your mate hesitates, you can still get help for yourself. If you'd like to learn more about the impact of gender differences in everyone's marriage, check out the free resources in the show notes below. And remember, I'm here to help. Thank you for listening to this episode of A Wise Woman's Guide to Men and Marriage. What did you think? Did the information raise more questions? Do you want to learn more? Head over to A Wise Woman's Guide for show notes and links to the resources mentioned in this episode at awisewomansguide.com.